So I'm with Dr. Terry Baker and with Modesta Sonder, and they have started the Kenya Sollay Foundation. And I can tell you that this has been super exciting for us to be a part of. And this whole project, we've done some quick videos, and you've shared a lot of the experiences, a lot of the lives that have been saved, which are literally happening on a daily basis at this hospital. And this hospital project is a phenomenal project, but I'd like it, if it's possible, if you could elaborate on a little bit of where the vision is for Sollay Kenya Foundation and other projects and things that you've got looking forward in the next 3 to 5, 10 years down the road.
Yes. I'll get started with that question, and Modesta will complete it. Our vision is about 300 facilities that either we open primarily or we network with other agencies and organizations to complete their dreams of providing healthcare and diagnostic centers strategically placed throughout the continent of Africa. We believe there is no greater gift to the African continent than the people of Africa. And it often requires so little intervention, so little food, so little water, antibiotics, IV fluids, so little medication in order to save a life and make a difference. The greatest resource of all of Kenya and all of the African nations are its people. And so that's our first vision. We also see some specialty projects. For example, fresh water that's low in salt is needed. Many disease processes in the African nations come from a lack of fresh water that's not only clean and free of bacteria and germs, but also low in sodium, salt. Also, we see a need in certain parts of Africa. There has been an excess of lead has leaked out into the land, the soil, the water, like down around Mombasa, for example. There's excessive lead has leached out into the soil, the air, the water, and children and adults have lead poisoning and or elevated lead levels, which can affect you in many different ways and causes a significant medical problem. Also trauma. In the past, our first hospital, Kitani Hospital, is located in Kitani, Kenya, is near gravel and stone quarries. One of the largest industries in that part of the country. And when you're working with gravel and stone, there's a lot of injuries that occur. Cuts and lumps and bumps and bruises and falls and broken bones and cracked skulls. And so our Kitani Hospital is strategically located near the stone quarries and have helped to save the lives of many a healthcare worker that in the past may not have survived. Modesta?
Thank you. I was born in Africa, in Kenya specifically, and just growing up, I saw that a lot of people were dying needlessly. People would die from simple malaria, malaria that is treatable. People would die from simple pneumonia that could be treated. I lost family and friends needlessly. So when I came to America and met up with Dr. Baker, we talked about the suffering that happens over there, and we decided to open up the foundation. So we came together and organized ourselves, and out came Sollay Kenyan Foundation. And through this foundation, our goal was and still is to build several facilities in Africa to just take care of these basic medical needs and to avoid, to help one or two families who otherwise would have died. So our goal has been just to buy medical equipment and go to different countries in Africa and open different facilities. We have started with Kitani Hospital in Kenya, and that is the first one, but we're moving on and building other facilities in different countries. We're partnering with people like iMedical to make this happen. So I just want to thank you, iMedical, for all that you're doing, for supplying us with the needed equipment to be able to take care of our patients.
I'll tell you, it's absolutely phenomenal. That's one thing that's very unique about our industry, both on our side of it with the medical equipment and your side with treating the patients, is that it's not a normal type of industry. It's not a normal type of business. When you're talking about saving people's lives and the impact that you're having, and you're doing it firsthand. So, I mean, we have so much admiration for all the hard work and effort that you put into this project. We played a very small part. We're very honored to do it, and we're so excited about all the opportunity and all the lives and people that'll be saved from the efforts of John, our biomedical guy, and Garnett, our biomedical people, and all those people, like even today, that are deinstalling mammogram equipment that's going to go overseas, and all the staff and all the people that put effort in. But in the long run, the results that it's going to have in some faraway place that'll save lives is absolutely phenomenal. And I'm so grateful that we've had the opportunity not just to be able to meet you, but to work with you. But I'm very excited also about the future that we have together, working on future projects and where this is going. And so once again, what I'm going to do is just let everybody know that we are going to put your web address down here. It's KenyaSollayFoundation.org. Is that?
It's Sollay Kenyan.
I'm sorry. I always do that, but that's what makes this. That's what makes this. We're not reading teleprompters here, Modesta. This is the real deal. We're live in person, but I'm going to put that down there. So if there's other people out there, and we get a lot of people, Doctor. We had talked in Modesta. We had talked about so many people that come to iMedical that are buying equipment, that are in the middle of projects, and I've got a couple really special people that we've had in here in the last month that I'm going to put you in contact with. And with that being said, I'm going to get this video ended. I want to shoot one or two more before I let you go and get you back home. But thank you so much for everything you do.
Thank you.
Thank you.